Welcome to the Self-Employed Practice Guideline for Nurses online education module. This module is based on our practice support tool, Self-Employed Practice Guideline for Nurses, located on our website. This module will cover the mandate of NSCN, self-employed practice in Nova Scotia, including discussion of scope of practice and professional practice, informed consent, both expressed and implied, policy and procedures for self-employed practice and consulting with other professionals, conflict of interest, advertising and endorsing products, designations and credentials, liability coverage, and conclude with key points. The Nova Scotia College of Nursing mandate is to serve and protect the public interest, preserve the integrity of the nursing profession, maintain public confidence in the ability of the nursing profession to regulate itself, and to set and monitor standards for the profession. There are approximately 14,000 nurses registered with NSCN that provide nursing services to Nova Scotians. This includes LPNs, RNs, and NPs. All nurses are accountable to provide nursing services that fall within their legislated and individual scope of practice. If you are unsure if the services you are providing are within your scope of practice, please contact an NSCN practice consultant. All nurses, LPNs, RNs, and NPs, self-employed or not, are required to collaborate with the most appropriate healthcare provider when required. LPNs are required to collaborate with the most appropriate healthcare provider when their clients' needs become less predictable or exceed their individual or professional capabilities. RNs are required to collaborate with a physician or NP when their clients' needs exceed their individual or professional capabilities. NPs are required to collaborate with a physician when their clients' needs exceed their individual or professional capabilities. All nurses provide client care from admission to discharge, including ending the client relationship, and are accountable to ensure their practice complies with the respective standards of practice and code of ethics, the legislated definition of nursing services in the Nursing Act, NSCN practice documents, applicable provincial and federal laws, and best practice guidelines related to nursing and business practice. The NSCN website has resources on regulatory policies and federal or provincial laws related to nursing practice. Self-employed hours must meet the legislated definition of nursing services found in the Nursing Act. For questions related to your self-employed hours, please contact the registration team. Clients do not always stay in the same practice, and it is important to keep in mind that ending the client relationship requires that the client have the opportunity to arrange alternative services. Please see the Abandonment Practice Guideline for further information. In addition, there is information for NPs regarding ending the client relationship in the Nurse Practitioner Practice Guideline. Both of these documents can be found on our website. Informed consent is a client's agreement to allow treatment to occur. Nurses must obtain informed consent prior to providing any service to a client. There are two types of informed consent. Express consent is where the client specifically gives permission either verbally or in writing, and implied consent where the client provides permission through their actions, such as rolling up their sleeves to have their blood pressure taken. Consent must relate directly to the intended treatment or service, including fees, services, or billing practices. Nurses are accountable to ensure the client is capable of giving consent, and if not, utilizing the substitute decision maker. Further information on substitute decision makers and informed consent can be found in the document Assessing Capacity Practice Guideline found on our website. Information presented to the client as part of the consent process must be clear and easily understood and must include full disclosure of the likely risks and benefits. Policy and procedures are required in self-employed practice to ensure consistent practice between clients and to demonstrate the nurse's accountability to provide safe client care. Self-employed nurses should consider developing policies such as scope of business and nursing service, scope of practice of the nurse, documentation, confidentiality and storage of information, informed consent, supply procurement, maintenance, repair, cleaning and storage, client recruitment, consultation with other care providers, and business management, such as billing, advertising, product endorsement, and insurance. Developing policies may be challenging initially. We recommend consulting with a lawyer, accountant, or business consultant to ensure that your policies are based on best practice and reflect relevant legislation such as the Personal Health Information Act. A conflict of interest occurs where an individual is faced with competing interests, where serving one interest negatively impacts the other. Typically, this relates to situations in which the personal interest of the nurse might adversely affect a duty owed to a client to make decisions in the benefit of that client. Your primary responsibility is to provide professional care to the client, recognizing you are in a position of trust and cannot use your position to influence clients for your personal or financial gain. A nurse may continue to work for an employer and maintain a self-employed practice. It is important to consider that a potential conflict of interest and role confusion can occur if the nurse provides services as a self-employed nurse in the same facility in which they are employed as a staff nurse. Examples of potential conflicts of interest include using the role as a staff nurse to recruit clients for your own business, collecting a specific fee for a service while simultaneously being paid by an employer to provide that same service, withholding elements of care within your scope of employment in order to provide that service in your self-employed role, or receiving a benefit from a manufacturer or distributor for endorsing their product over another. Endorsing products or services can be closely linked to a conflict of interest because clients may feel purchasing the product is a condition of the service you provide. Self-employed nurses may use a wide range of products as part of the services they provide to clients. Within the context of care or service provided, nurses may recommend or provide a product either free of charge or for a fee to clients for their own self-care. Nursing credentials must not be used to endorse products or services that are not related to the care or service provided. For example, a nurse with a foot care business may endorse certain products to minimize ingrown toenails, but may not endorse toenail polish. You must take precautions to ensure that the nurse-client relationship is not used for your personal gain. The purpose of advertising is to provide information so consumers can make informed decisions when selecting a nurse. Advertising must be ethical, truthful, accurate, professional, verifiable, and maintain the dignity of the nursing profession. You are required to use your name and professional credential in any advertisement for your nursing business, including the need to identify yourself using your full designation, such as LPN, RN, or NP. Guarantees of results, unsolicited testimonials, or individual product endorsements are not appropriate in advertising material. In order to present an accurate image to the public, NSCN does not authorize the use of terms such as expert or specialist, or credentials that have not been obtained through licensure or granted through a certification program. You could be held accountable for any untoward client outcomes related to the use of an unapproved designation, title, or abbreviation. The term certified cannot be used in your designation unless the following criteria is met. A national or international board or association oversees the certification program and grants the certification. The applicant demonstrates the competencies required by the national or international board or association. The applicant has formally demonstrated their competencies via an exam. The applicant maintains their competence through formal methods such as re-examination or portfolio development. All nurses licensed with NSCN have professional liability insurance. LPN's liability carrier is Lloyd's Sad Insurance Brokers Limited, and RNs and NPs have liability coverage through the Canadian Nurses Protective Society. Nurses in a self-employed practice should consult with a business lawyer and respective liability provider to discuss whether additional protection is necessary. To conclude this module, we will leave you with some key points. Self-employed nurses are required to ensure these key aspects for their practice are addressed. You are accountable to meet your standards of practice, code of ethics, and applicable legislation. You must provide services that fall within your professional and individual scope of practice. You are required to have a practice that meets the legal definition of nursing services in order to count practice hours. You must establish nursing and business policies. You must determine if additional liability insurance is required. You should be aware of and take action to avoid conflicts of interest. You may endorse products but must ensure the nurse-client relationship is not used for personal benefit. You must be aware that any advertisements should be ethical, truthful, accurate, professional, and verifiable. And you should know that NSCN does not authorize the use of credentials that has not been obtained through licensure or granted through a certification program. There are additional practice resources found on our website that may be helpful for your self-employed practice, such as guidelines on documentation, medication, abandonment, assessing capacity, foot care, and nurses recommending and administering over-the-counter medications or devices. Thank you for participating in this online education module. The Self-Employed Practice Guideline for Nurses document that has been used in this module can be found on our website. We encourage you to reach out to the practice team should you have any questions.